Hi, I'm Professor Helen Murphy. Through all the research we have done as well as our clinical experience, we've learned a lot about using CamAPS FX in pregnancy. This short animation is designed to help you get the best out of this pregnancy-specific closed-loop system for you and your baby. There are a few app settings that you should adjust, together with your diabetes team, as your pregnancy progresses. When pregnant, the glucose targets are tightened to reduce the risk of possible pregnancy complications. The sooner these targets are met, the better, but everyone is different and your diabetes team will help guide which targets are best for you to aim for. Ideally, the HbA1c target is 42 millimoles per mole or 6%, and the time in range target is adapted to spend more than 70% of time between 3.5 to 7.8 millimoles per liter. You can change your time in range target by opening the settings menu and going to statistics. The app's personal glucose target controls the level the algorithm is aiming to achieve when auto mode is on. The default target is 5.8 millimoles per liter. You are able to set this target anywhere between 4.4 and 11 millimoles per liter across the 24 hours of the day. In the first trimester, when the risk of hypos is higher, the personal glucose target is commonly set to 5.5 millimoles per liter. In the second and third trimester, the personal glucose target is often lowered to 5 millimoles per liter in the daytime. If appropriate, the overnight target might be adjusted from the evening meal or bedtime to waking to 4.5 millimoles per liter. You can change your target in the Settings and Personal Glucose Target menu. The insulin to carbohydrate ratio needs to be reviewed frequently as the pregnancy progresses and insulin resistance increases. Choosing low glycemic index carbohydrates and keeping the portion sizes small but spreading them throughout the day will help achieve optimal nutrition as well as target glucose readings. Ideally, insulin should be given at least 10 to 15 minutes before eating. This timing may need to be increased later in pregnancy. Boost is a feature that makes CamAPS FX more responsive to help bring glucose levels back into range more quickly. During pregnancy, we encourage you to use Boost more often. For example, if your glucose level is high after a meal, using Boost for 2 to 4 hours can really help. If Boost needs to be used frequently, your insulin to carbohydrate ratios and bolus timing might need to be reviewed. Please check for ketones if your glucose is running high. Seek urgent advice from your diabetes team if ketones are present. Please immediately change your infusion tubing, cannula, and reservoir if you are running high and Boost is not bringing glucose levels down. As the pregnancy progresses, you may need to change your infusion set and reservoir more regularly, possibly every 1 to 2 days, to ensure that you are absorbing the insulin properly. When away from home, please don't forget to pack your bag with plenty of spare infusion sets, reservoirs, sensors, blood glucose, and ketone testing equipment as well as insulin pens and vials. Body weight contributes towards helping CamAPS FX manage post-meal glucose levels. We recommend that body weight is updated about every 4 weeks in the Settings and Change Weight menu. When CamAPS FX is not working, such as when the sensor is warming up, the app screen will go orange and the pump will resume delivering the pre-programmed basal rate. We recommend that the pump basal settings are updated about every 4 weeks on the pump as your insulin needs increase throughout your pregnancy. You may also like to think about what alerts you set in the app to help you respond to highs and lows at the different stages of your pregnancy. Please speak with your diabetes team about what alerts are right for you. You can share your diabetes data with your healthcare team as well as loved ones in a few different ways in the Share menu. You can automatically stream your data to Gluco or MyLife Cloud as well as a loved one following you in real time via the companion feature. Towards the end of pregnancy, it is good to plan the setting changes that need to be made at the birth. The personal glucose target needs to be increased to at least 6 millimoles per liter across the 24 hours of the day, just before or after the birth. Agree more relaxed insulin to carbohydrate ratios with your diabetes team, which can be programmed into the app's bolus calculator settings after the birth. Program a reduced pump basal pattern B on the pump. Pattern A's basal rate would have been increased throughout the pregnancy as a safety net in case CamAPS FX couldn't work. Only swap to pattern B on the pump when the baby is born. All these changes should be written down in your medical notes, and you should also have a copy. During the birth, CamAPS FX can continue to manage insulin delivery, if agreed with your healthcare team. If a C-section is planned, please make sure you place your cannula and sensor away from your stomach. Please also check the accuracy of your sensor and calibrate or replace it if the sensor is reading more than 3 millimoles per liter above or below your blood glucose reading when your sensor arrow is stable. After the birth, very little insulin may be needed in the first 24 hours. The real priority is to avoid hypos. Remember to set your new personal glucose target and insulin to carbohydrate ratios in the app. Consider using Ease Off to make the algorithm more relaxed and reducing the pre-meal insulin bolus, especially if breastfeeding. There is no need to try restart the algorithm. It will quickly adjust to your post-pregnancy requirements. Please change the time in range setting back to 3.9 to 10 millimoles per liter in the Settings and Statistics menu. Our research results showed that those women using CamAPS FX at 6 months after the birth were achieving 70% time in range, even while caring for a newborn.